You probably know someone who has asthma. In fact, nearly 22 million Americans are living with it. Asthma is just something you have to manage every day. It's part of your lifestyle. I've lived with asthma all my life. My chest was constantly tight growing up. I was used to feeling short of breath. It took me a really long time to realize there was something I could do to keep my asthma symptoms under control. I've gotten much better at managing my asthma. I've started taking my medicine more regularly, not just skipping a dose when I thought I felt better. I take my maintenance inhaler in the morning when I wake up and right before bed. It's just part of my routine, like brushing my teeth or washing my face. Despite the disruptions in my life, I've learned to be proactive about managing my asthma before a flare-up happens. It's made a real difference in my life. It's not always easy to keep my routine, but it's worth it. My doctor prescribed me Qvar, which is approved for the ongoing treatment of asthma to help prevent asthma symptoms. Qvar does not replace my quick relief inhaler for my sudden asthma symptoms. Since I've been taking my Qvar twice a day, every day, it's been helpful in managing my asthma symptoms. I noticed the benefit, and that really motivates me to keep taking it. My asthma is still a part of me and always will be, but by managing it better, I can keep my symptoms under control. It's so important to develop a routine that works for you and stick with it, even on the good days.
Prescription controller medicines, like Qvar, may help to reduce airway inflammation, or prevent or decrease asthma symptoms and improve lung function. Using a rescue inhaler alone when you have symptoms does not treat the underlying airway inflammation, one of the causes of asthma. Remember, do not use Qvar if you are allergic to beclomethasone dipropionate or any of Qvar's ingredients. Also, don't use Qvar more often than it is prescribed, and do not stop using Qvar abruptly without consulting your healthcare provider.
Asthma is something that has to be managed every day. Find a routine that works for you and stick with it.
Important safety information. Qvar does not replace quick relief inhalers for sudden symptoms. Do not use Qvar if you are allergic to beclomethasone dipropionate or any of the ingredients in Qvar. Do not use Qvar more often than it is prescribed. Do not stop taking Qvar abruptly without talking to your healthcare provider. Qvar may cause serious side effects, including fungal infections, thrush. Tell your healthcare provider if you have any redness or white-colored patches in your mouth or throat. Rinse your mouth after using Qvar to help prevent an infection in your mouth or throat. Worsening asthma or sudden asthma attacks. After using your rescue inhaler, contact your healthcare provider right away if you do not get relief from your sudden asthma attacks. Decreased adrenal function. This potentially life-threatening condition can happen when you stop taking oral corticosteroid medicines and start using Qvar. Tell your healthcare provider right away about any symptoms such as tiredness, weakness, nausea and vomiting, and dizziness or faintness. Immune system effects or infection. Tell your healthcare provider about any signs or symptoms such as fever, pain, body aches, chills, feeling tired, nausea, or vomiting. Increased wheezing right after Qvar use. Always have a rescue inhaler with you to treat sudden wheezing. Serious allergic reactions. Stop using Qvar and call your healthcare provider or get emergency medical help right away if you get any of the following: hives, swelling of your lips, tongue, or face, rash, or breathing problems. Slowed growth in children. Children should have their growth checked regularly while using Qvar. Lower bone density. This may be a problem for people who already have a higher chance for this condition. Eye problems. If you have had glaucoma or cataracts in the past, you should have regular eye exams while using Qvar. The most common side effects of Qvar include headache, throat irritation, and sinus irritation. Approved uses. Qvar, beclomethasone dipropionate HFA inhalation aerosol, is used in the ongoing treatment of asthma as preventative therapy in patients 5 years of age or older. Qvar is also used for asthma patients who require systemic corticosteroid administration, where adding Qvar may reduce or eliminate the need for systemic corticosteroids. Please see the full prescribing information at www.qvar.com or call 1-888-482-9522 to have a copy sent to you. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/MedWatch or call 1-800-FDA-1088. It's important to work with your doctor to develop an asthma management plan that works for you. To learn more, visit qvar.com.
You too can help take control of your asthma by using maintenance inhalers like QVAR every day as prescribed, and not just when you feel symptoms. Make it a part of your daily asthma health routine and stick with it.